When vaccination is the clearest route out of the pandemic, speed matters. And the UK is a world leader, with some in government believing that all adults could be offered their first dose by the summer. But it's not the offer of a jab that matters, it's whether people actually get it. And lower uptake of the vaccine among Britain's ethnic minority community is a serious concern. People from Black, Asian and minority ethnic groups are more likely to die from COVID-19 than white people, but there's also higher levels of hesitancy towards the vaccine. Birmingham Ladywood is one of the most diverse constituencies in the country. Their Labour MP, Shabana Mahmood, says she's fielding calls from worried constituents regularly.
What I've been picking up from doctors and other people on the front line in my constituency is that there is much more vaccine hesitancy among some of our Black, Asian and other ethnic minority communities. They're picking up many more people who are saying no, that they don't want the vaccine, and they are concerned about it. So, that's been flagged with me by local GP practices in my own constituency, and I know that others in Birmingham are doing the same.
Figures from the Royal College of GPs, shared exclusively with Sophy Ridge on Sunday, shows that 91% of people who've received a vaccine are white, and only 5% come from Asian backgrounds. Just 2% are black and 1% mixed race. To put it another way, 14% of white people have received at least one dose so far, compared to just 9% of Asian people, 7% of black people, and 5% who are mixed race. White people are twice as likely to have had a vaccine than black people, and more than 3 times more likely than the mixed race population. Barriers to healthcare access could be a factor, and some argue that a wider lack of trust is at play.
There's a general mistrust of the NHS because there's some histories, certainly in the UK as well as abroad, which have not been good. And these are validated from royal colleges. So, for instance, the Royal College of Midwives, Royal College of Obstetrics and Gynecology tell us about the very poor outcomes for Black and ethnic minority people in respect to pain control during delivery and indeed stillbirths, etc. So one's got to ask, why is that? There are issues, of course, well known in the field of psychiatry, where a lot of younger Black people are grossly overrepresented, and people have done the matching analysis. They are sectioned much more quickly. They are given various drug regimes much more quickly than their white counterparts. So there is this general mistrust.
Dr Michael Dawes is a junior doctor from Birmingham who's been on the front line in the fight against COVID-19 since the beginning. He's been shocked at some of the things he's heard from nurses on his own wards.
It really shocked me when nurses would actually go and tell people, don't take the vaccine. But what really got me the most is when I heard one of the nurses I spoke to say, come on, you call your Black nurses, auntie, come on, auntie, we need to go get this vaccine, da, da, da. And she's like, no, my pastor said no. And I'm like, what? And that shocked me. It got me angry. And I said to her, give me your pastor's number and let me speak to your pastor.
Don't let misinformation put you or your loved ones at risk.
MPs have been trying to encourage their constituents to get vaccinated, with a video from a cross-party group of Black MPs presenting a united front.
I will be taking the vaccine.
I'll be taking the vaccine.
When it's my turn, I'll be taking the vaccine.
But outside of Westminster, community action is seen as key, and some doctors have their own strategies to get the message out.
I've been researching and asking people, what is it that we can do as healthcare professionals to help build that trust back? I think that in order for us to be effective in vaccinating the Black community, we have to build back that level of trust. We've already done a vaccination program where we talked about it, where we gave people the opportunity to ask questions and we give them the answers. And if any answers that we don't have, we go and seek them out and point them in the right direction.
There's widespread support for this kind of community-based action, but there are also calls for the government to tailor their messaging more towards different communities.
The messaging, I've said, is paramount. It has to be good, it has to be consistent. It has to have transparency and, most of all, honesty. And I'm unfortunately in these categories, in quite a few situations, I think this government has come up short. What governments have to do, they have to harness members of those communities, members who are trusted, members who are well known, from the spectrum of the age groups, be it footballers, poor Marcus Rashford, but the Rashfords and the Sterlings, the Lenny Henrys, people are well-known faces. They have to get those people involved in the messaging. And also, very importantly, at the community level, you have to engage with community leaders, with the church leaders or the mosque leaders, and that's happening to some extent. That is the way you're going to do well, not by some top-down comments.
The Royal College of GPs says that if the government doesn't get a grip on vaccine take-up, particularly among communities worst hit by the virus, COVID-19 could remain a threat in some parts of the UK for much, much longer.
And if you'd like to go down to the lady breathing, okay, you don't.
It may be a bit early to speak of Britain's vaccine success just yet.